Hey guys, welcome back to my channel. So today in this particular session we'll try to find out how to identify LVH and Lbbb. That is, LVH means left ventricular hypertrophy and Lbbb means left bundle branch block. How to identify, how to find out in an ECG, right, of any person. So that will be the motto of this video. So I hope you are enjoying all other previous videos in this ECG series, and I hope you have already listened to that part. And today in this session we'll try to find out not very rare, also it's very common as well in the ECGs. So we'll try to find out how to identify them, and it's easy to find out, right? So guys, firstly I will try to share some basics, right, with you before going into the LVH and Lvv per se. So firstly, this is the normal sinus rhythm ECG, right? Basically, if you will see, this is the second lead which is given over here, that is the rhythm lead, as we have talked about earlier as well. And here you can see that RR intervals are equally placed, that is they are having, this patient is having the regular rhythm, right? And the QRS complex is also narrow. QRS complex is also narrow, you can see, with every with every rhythm. And probably this patient is having heart rate of around 70 beats per minute, because the RR interval, if you will be counting off, so approximately around 4 large boxes are there. It means if you will be getting the formula, so it will be around 1500 divided by 20 small boxes, right? So it will be around 75 beats per minute. So that's why I said this patient is having the normal sinus rhythm, right? And if you are aware of the previous video as well, guys, I have talked about the atrial flutter versus fibrillation, where I told you that in the atrial fibrillation the patient will be having the irregular rhythm, right? So how to calculate the heart rate in that scenario also we have talked about, right? So that is the thing. But in this session, what I want to discuss is, look at this one, guys, the chest leads, right? So what are the left sided chest leads and what are the right sided chest leads? So if you will be placing the chest leads onto the chest of to the patient, right? So you will be seeing that you will be going more on the left side. From the right side you are beginning to place the leads onto the patient, and then you are going toward the left side, right? So generally what we are saying is that if you are placing the V1 lead, you are more towards the which side, left or right side? You are more toward the right side, right? So basically V1 and V2 are your right side leads, and you will be going towards the left side at last. So V5 and V6 are your left sided leads, right? So they are your left sided leads, and V1 V2 are your right sided leads. Okay, so please do remember this particular thing over here. So if you talk about the LVH, right, and one more thing before going to the LVH, guys, if you will be seeing the right, if you will be seeing this thing, I mean in the V1 you will be seeing the R wave, right? Everybody knows that this will be the Q wave, this will be the Q wave, this will be the R wave, right? And this will be the S wave. So generally what we are seeing, that R wave is always bigger. For example, this is the second lead, so Q, right? So Q, R and S, right? So R wave is always bigger, R wave is always bigger, isn't it? But over here, if you will be looking at the normal variant of the ECG, V1, in the V1 lead, I am saying the R wave will always be smaller than the S wave, right? So as you can see over here, R wave is just this one and S wave is much bigger one, right? So the I'm sorry, so R wave is always smaller than the S wave in lead number V1 chest lead, right? So I'm saying that, so please do remember that. And as you will be progressing further, like as you will be progressing further, you will be going towards the V2, V3, V4, V5. So R wave length will be actually prolonging. So if you will be comparing the V1 R height with the V2 R height, V2 R height is more, right? Then probably V3 will also be increasing than V4, V5, V6, and in the V5, V6 R wave will be much taller. So for example you can see over here, V5, V6 R wave is much taller as compared to the V1 lead. So we can say that left sided leads will be having the more height as compared to the right sided leads, and you can see this is the R wave, this is the S wave. S wave becomes smaller now, right? So from the V1 in the V1 we saw that there was taller S wave as compared to the R wave, but in the V5 V6 story changes and exactly opposite happens. R wave is having the maximum height and S wave is having the smaller height. This is called as the R wave progression. So as we will be progressing from the V1 to V6, okay, chest lead, the R wave progression will also happen. So this is called as a normal variant in the ECG. So normally R wave progression is also one of the criteria where we are analyzing the ECG, and we can say that with how is the R wave progression. Okay, sometimes you must be hearing the physicians are talking about some patients and they are saying there is a poor R wave progression, right, or there is a poor wave progression, or there is a poor progression in the ECG. So it means they are talking about the R wave progression in the ECG particularly, right. So it is very easy to find out. Just look at the V1 to V6 and look at the R wave heights. If the R wave heights are actually increasing in heights from the V1 to V6, it means the person is having the normal R wave progression. Okay, so once we have talked about this normal thing, we have talked about very important R wave progression. Once we have talked about that, now we shall jump on to the LVH, right? LVH, that is the left ventricular hypertrophy. So guys, for the LVH, in the past there have been many criteria, but right now we are actually following the very important criteria, that is the Sokolow-Lyon criteria. Okay, so we are following the Sokolow-Lyon criteria. So according to the Sokolow-Lyon criteria, okay, we are finding out that the patient might be having the ECG, for LVH or not. So if you talk about Sokolow-Lyon criteria, it says that S wave in V1, okay, S wave in V1, we saw that it is much bigger than the R wave, right, in the V1 lead, plus R wave in V5 V6. So S wave in V1 plus R wave in V5 V6, you have to count the number of small boxes. Okay, so number of small boxes you will be counting for the S wave in V1 and R wave in V5 or V6. If it is more than 35 mm, okay, one large box is carrying the 5 small boxes, that is the 5 mm, so it is carrying the 35 small boxes or 35 mm. If it is more than that, right, then we can say probably that person is having the LVH or left ventricular hypertrophy, right. Okay, fine. Or the patient might be having the height of R wave in AVL, more than 11 mm, more than or equal to 11 mm, height of the R wave in AVL lead. If it is more than or equal to 11 mm, then also we can say that patient might be having the LVH. Let's try to find out in the ECGs as well. Okay, let's try to apply that in the ECGs, for example. So now let's look at this particular ECG. Here, if you will be focusing on the lead number V1, as we can see, this will be the Q wave, this would be the R wave, and this would be the S wave. What we need to do, guys, yes, we need to count the number of small boxes. So if we will be counting the boxes, right, so 1 2 3 4 big boxes, it means 21 small boxes are there. If we will be reading the boxes in the V5 or V6, right, we need to look at the R wave exactly. So if we will be looking at the R wave, 1 2 3 4 5, around 26 small boxes are over here, right. So what we need to do according to the Sokolow-Lyon criteria, we need to add the number of small boxes in the S wave of V1, and we need to add that with the V5 or V6 R wave number of small boxes, right. So 21 plus 26, it becomes around 47. So around 47, which is more than 35 mm. So yes, it meets with the Sokolow-Lyon criteria, right. It meets with the Sokolow-Lyon criteria, that is more than 35 mm. So sum of S wave in V1 and R wave in V5 or V6 more than, if it is more than 35 mm, so it meets up with the Sokolow-Lyon criteria. So over here it is becoming around 47 mm, right. So that is more than 35 mm obviously, so that becomes your LVH diagnosis, that is your LVH as diagnosis, left ventricular hypertrophy, right. One more thing, so according to Sokolow-Lyon criteria, you can also check the AVL, lead number AVL, right, and in the AVL, if it is crossing more than 2 large boxes or more than 11 mm, right, equal to or more than 11 mm, so also you can say, then in that case also you can say it is LVH. So 1 2 3 approximately around 14 small boxes are there. 14 small boxes are there, so that criteria is also meeting. So in the AVL it is more than 11 mm, it is obviously more than 11 mm in the AVL, right? So right, in that matter we can say that this is the case of left ventricular hypertrophy, that is the LVH, right? Okay, one more example, let's try on this example as well, right? So here what I can see is that yes, so lead number V1 again guys, right now I'm not focusing on the other things in the ECG because we are discussing the LVH, right? Later on when you will be reading all the ECGs and all the diagnosis and all, then it will be easier for you to find out what kind of pathology or what kind of multiple pathologies are there in the ECGs, right? At least it gives us the hint. So in the V1 and in the V6, okay, we are gonna focus over here. In the V1, if I will be counting the boxes, you need to focus on the S wave in the V1 and R wave in the V5 or V6, right? We know that very well. So I'm gonna count the number of small boxes over here as well. So number of small boxes like 1 2 3 4 5 big boxes, it means that is 25, or I can say that is 27 small boxes, right? If we count the R wave number of small boxes in the V6, so we need to focus on the R wave. 1 2 3 4 5 6, almost 6.5, so almost around 33 small boxes are there. So 27 plus 33, around 60 small boxes. So yeah, so it is obviously more than 35 mm. So here also we can say that is left ventricular hypertrophy LVH, right? Later on we can see the AVL also. Here I can see that it is around 13 mm approximately. So here also that makes the diagnosis of LVH, left ventricular hypertrophy, right? Now let's focus on this particular ECG. Let's look at the V1, right? S wave in V1. So yeah, so there are a lot of boxes, 1 2 3 4 5 6 7, around 36 small boxes are there in the S wave of V1. In the V6, 1.5, so around 7 boxes are there. 36 plus 7, it becomes 43 small boxes, so more than 35 obviously, so that becomes your LVH. Seeing that AVL, right, seeing that there is AVL around 10 boxes are there, so that is fine. But over here this patient is having Lbbb also, that is the left bundle branch block also. So LVH plus Lbbb is there. Okay, I will come back to this ECG again because right now we don't have the knowledge of Lbbb, right? I didn't told you yet. So after explaining the Lbbb criteria of Lbbb, we will come back to this ECG as well. So for now just understand that this patient is having the LVH obviously, right? Okay, now let's look at this one. So now guys, once we understood that how to diagnose the patient with LVH through the ECG, now we shall move on to the left bundle branch block Lbbb and how to recognize the Lbbb in the ECGs of the patient, right? So now over here again guys, we need to focus on two things over here. One is the lead number 1 and another one is the lead number V1 and V6, right? Just like in the LVH we were talking about. So V1 and V6. In the V1 we need to focus upon either the RS wave, so Q wave is there and R wave is not there as such, or I would say that if I was talking about in the V1 in the normally also, right? So I told you, if you guys remember, that there is very small deflection is there in the R wave, very small deflection in the R wave. So Q wave, R wave and then big S wave is there in the lead number V1, right? So here also we can see that as such the as such the R wave is not present over here. So Q wave and then there is a S wave over there, right? Here also Q wave and then S wave over here. So what I can see is that over here we are having a deeper S wave, but at the same time we can see that they are broad. At the same time we can see that they are broad, right? Now please remember, if they are broad, right, and they are making a pattern like W, as you can see they are making a pattern like W, they are making a pattern like W. So if we are seeing that W pattern in V1, W pattern in V1, right, W pattern in V1, and the QRS complex is broad, and the broad QRS complex we are seeing, or broad QS wave we are seeing, then probably we are talking about the Lbbb, right? So W pattern in the V1 or M pattern in the V6, M pattern in the V6, and along with that you can include 1 and AVL lead also, 1 and AVL lead also, right? So in 1 and AVL these are the septal leads, or in the V6 if the broad QRS complex you are seeing at that place also, broad QRS complex, or you are seeing the M pattern in the lead number V6, then also probably we shall talk about that this patient is having the left bundle branch block or the Lbbb, right? So here we can see the QRS complex is quite broad, QRS complex is quite broad, right? So that is the case over here, right? Now we are seeing what pattern? We are seeing the M kind of pattern, right? We are seeing the M kind of pattern, isn't it? So W pattern in V1 and M pattern in V6 or lead number 1 and AVL, right? If we are seeing this kind of pattern, then we can say that this patient is having the Lbbb also. So first of all you need to find out whether the patient is having LVH or not. Once you are done with that, then you need to find out that is this patient having Lbbb also or not, right? Left bundle branch block or not, right? So let's find out in this ECG lead number V1 and lead number V6 and lead number 1 and AVL. Okay, we need to find out these leads for the left bundle branch block, right? So in this patient we can see that in the lead number V1 or in the lead number V6, if you will say V1 nothing much is there, but in the V6 we can see that there is a kind of M pattern, isn't it? There is a kind of M pattern is there, So in V6 we can see that there is a M pattern, and in the lead number 1 and the AVL quite broad QRS complex is there, so we can say that this patient might be having the left bundle branch block. Okay, let's look at this ECG. Lead number 1 broad QRS complex, lead number AVL broad QRS complex. In the lead number V1 nothing much is there, but in the lead number V6 we can see there is a M kind of pattern, so here we can say that this patient might be having the left bundle branch block, right? Now if you guys remember, I told you this ECG, if you will be look again, yes, we told you that there is a LVH because Sokolov-Lyon criteria is meeting over here. Look at the lead number V1 broad QRS complex, right? Look at number AVL broad QRS complex, right? And we can see very well M pattern is also there, right? In the V6, right, as such M pattern is not seen over here, but in the at least in the 1 and AVL we are having a broad QRS complex, and even in the V6 there is a broad QRS complex, right? So accordingly we can say that patient is having the LVH, yes, along with that the patient is also having the left bundle branch block, right? So I hope now you are having a bit clear understanding about the LVH and the Lbbb. So when we are looking at the ECG, now we shall find out easily that this patient is having either the LVH or the Lbbb, or in some patient you might say that the patient might be having both, that is the left ventricular hypertrophy along with that left bundle branch block too, right? So thank you for seeing this video, and if you have any kind of reviews, then please leave them in the comment section. Thank you. I will see you in the next one.